All right, so before I do my assessment, I'm going to look at the baby's chart and pay attention to the baby's birth history. I am checking the baby's APGAR scores. I am seeing how the baby was delivered, whether it was C-section or vaginally, and I'm also seeing if there was any traumatizing events that happened during the delivery. So I'm going in, knock, knock. Hi, my name is Brianna. I'm the student nurse. I am here to do an assessment on your baby. Is it okay with you if I do that? Perfect. So I'm going to close the curtain to provide patient privacy. I'm going to wash my hands and maintain the patient's dignity and safety at all times during this assessment. The biggest risk with safety in a newborn is the warmth. So before I get started, while the baby is calm and sleeping, I am going to put my hand on the baby's belly and assess respirations for a full minute. Then I'm going to listen to the baby's apical heart rate. I'm going to place my stethoscope in between the nipple line at the apex region and listen for a full minute as well. I am also paying attention to whether or not I hear any murmur. Next, I'm going to do the axillary temp. I'm going to measure the baby's head circumference at the largest part of the baby's head and the baby's chest circumference around the nipple line. I'm going to assess the baby's length starting at the top of the head to the tip of the toes. And I'm going to be putting the baby on a scale and weighing the baby. Next, I am going to assess the baby's general appearance. The baby is symmetrical in movement and is aligned. I am making sure that if the baby cries, I assess the baby's cry as well as muscle tone. So the baby should be flexed right now. I am going to assess the baby's skin next. I am looking in the creases of the baby's folds for vernix caseosa. I am looking for milia, which is white bumps on the baby's face. I am looking for lanugo, which is the baby hair on the upper arms or the upper back. I am checking for erythema toxicum, which is red irregular spots. I am looking for Mongolian spots, which are purple in color and look like bruises. And I'm also checking for red bumps on the baby's face, also known as petechiae. Next, I'm going to check the baby's head. I am making sure it is normal in shape and no molding. I am going to assess the posterior fontanelles, which should be in a triangle shape, and the anterior fontanelles, which should be in a diamond shape. I am checking both sides of the head and seeing if there's any cephalohematoma or swelling on either side. I am also going to palpate the suture line and see if there's any swelling, also known as kaput. I am going to check the baby's face and make sure that it is symmetrical. I am also looking at the baby's eyes. The iris should be light blue or gray. I'm going to assess for perla. There should be no accommodation and a sluggish reaction. The baby could also have some strabismus, which is normal. I'm assessing the conjunctiva, which are pink. I am making sure that there is no drainage, redness, or irritation to the eyes. Next is the ears. I am checking and making sure that they are fully formed and checking the alignment from the top of the ears to the corner of the baby's eyes. The nose, making sure both nares are patent so that the baby can breathe. I'm going to put on a glove and check the baby's mouth. I am putting my pinky inside the baby's mouth and checking the palate, making sure that it is formed and no holes. I'm also checking the sucking reflex of the baby. I'm also going to be checking the swallowing reflex of the baby when the baby does feed. I'm also going to look inside the baby's mouth and see if there are any Epstein pearls, which are white calcium deposits. Next is the baby's neck. I'm making sure that the baby does have a neck and assessing the clavicle with palpation to make sure that there are no holes in the clavicle and that it is stable. Next is the chest. I'm checking for equal chest expansion when the baby breathes. I am making sure that there are only 2 nipples and not 3, making sure that the nipples are intact, there's no swelling around them, no discharge or bleeding, and that that they're intact. I will listen to the baby's lungs and listen to their lung sounds. and I already listened to the baby's heart. So next I will be assessing the abdomen and making sure that there is no abdominal distension. I will be checking the cord and making sure that it is intact, that there are 2 arteries and 1 vein, and that there is no drainage, redness, or irritation. I will be listening to bowel sounds, which should be active and present shortly after birth. And I will ask the mom and dad how the baby's elimination processes are. Has the baby urinated? Have they had their first meconium or stool yet? Next, I will be going on to the baby's genitals. If it is a female, I will make sure that the labia is covering the clitoris and note if there is any discharge or bleeding. If it is a male, I will pay attention to the meatus, the location of it, making sure that it has 2 testes, their location, as well as rugae on the scrotum. While I am assessing the baby's genitals, I'm also going to make sure that the anus is patent. Next, I'm going on to extremities. I'm going to make sure that the extremities are, again, symmetrical in movement and muscle tone. I'm going to check for range of motion in all of them and assess the hip, make sure it is not dislocated, and make sure that it is stable. I'm going to check the fingers and toes, make sure I count all 10 fingers, all 10 toes, and along with assessing and making sure that everything is perfusing. Next is the spine. So I'm going to flip the baby over and palpate the spine, making sure there are no holes in the baby's spine. And while I have the baby over, I'm going to check the trunk reflex by moving my fingers down either side of the spine and seeing if the baby curves towards it. Next is the baby's reflexes. So I'm going to lift the baby's hands up, and that would be the Moro reflex. I'm going to check for tonic neck reflex by putting the baby's head this way. The baby's arm should move with it. And then the baby's head this way, this arm should go up. I'm going to check, I already checked the sucking and swallowing reflex. So I'm going to check for rooting. When I brush my finger along the baby's cheek, the baby should turn its head in that direction. Palmar reflex is when I put my fingers and the baby squeezes its hands around them. Plantar reflex, when I put my fingers along the baby's bottom of their toes and their toes curl around it. Babinski reflex, when I brush my hand across and down, the baby's toes should fan out. And stepping reflex. While I am doing this assessment, I'm going to make sure that I pay attention to the baby's behavioral state. I am making sure that the baby, whether the baby's in a deep sleep, a light sleep, whether the baby is drowsy, whether the baby is quiet and active, alert and active, or has intense crying.